Digestive disorders. This can be a fun one, but a really challenging one at times also. If you find yourself, again, going through different kinds of medication, in and out of the doctor's office, not knowing what's going on, gas, bloating, maybe pus or blood in your stool, and just really affecting the quality of your life, this video may be for you. Hi, I'm Dr. Alex Azadi, founder of Balance Within here in Encino, and today I'm going to be talking a little bit about digestive disorders, or in other words, a lot of you may know the terms IBD or IBS, irritable bowel syndrome. The list goes on and on with these kinds of different disorders. You know, it could go all the way from Crohn's to IBS and a whole plethora of signs and symptoms between the two. I'm here to talk about today and to kind of shed some light on the issue because I know it can be really frustrating, really aggravating, and disheartening to go through this and not feel like there's any means to an end. But believe me, I promise that most of the time there is. You just got to hang in there. You will eventually get there. I've seen it time and time and time again. There are, certain cases where situations may be a little more intense or progressed. So the person may need some sort of surgery. So this obviously is not geared towards speaking to those individuals, but if you're not there yet, which I anticipate that most of you aren't, this video should shed some light on how to approach the situation. One reason why I decided to make this video is actually just yesterday, a young female came into the office, 33 years old, had been back and forth to her doctor, battling IBS for God knows how long, maybe it was 9 years. And her case was fairly intense, and her doctor gave her, different types of medications, steroids, and different things to do, and nothing seemed to help. Which after, multiple years, she's like, okay, let me try something different and incorporate something that I haven't been incorporating, which is why she found acupuncture. Acupuncture approaches this from an angle of imbalance, right? Again, with the foundations of acupuncture, you have the symbol of yin and yang. Not to get too far off of the topic of treating it, but I do want to hit home the fact of traditional Chinese medicine is based on the idea of balance. And when things are not in balance, when things are not in an equilibrium, is when you start to have a lot of these issues. So as I mentioned before in a lot of my other videos, Western medicine is amazing in what it does and what it brings to the table for certain ailments. But there are a lot of ailments that it falls short. And this could be or can be one of them. This is where acupuncture, traditional Chinese medicine, when incorporated with herbs properly and a lot of different lifestyle changes, really one-ups Western medicine from a lot of angles. So one thing that we target when you come in is really finding where your imbalance is. Traditional Chinese medicine labels these digestive disorders mainly using the name of dampness, right? Either there is a deficiency of something, or there's an excess of something else in the gut, or there is this environment in your gastrointestinal tract that is causing things to run damp. Now, what is damp? If you think of damp weather, hot, sticky, thick, muggy, you're really not going to enjoy being in that weather. Well, your insides are really the same way. When your insides are functioning in a very damp environment, they're not going to be functioning at its optimal stage, right? Its optimal pace. So this is where we use acupuncture and specific types of herbs in a very systematic sequence to change the environment inside of you and get that dampness to drain. And how do we get it to drain? Either through sweating, peeing, or pooping, basically. Now, a lot of people may ask, well, if I get a treatment for, my IBS that I've had for this many years and I'm laying on the table, where are the points going to be? Well, that really depends. As your practitioner, we're going to check your pulse. We're going to take a look at your tongue. We're going to take your vitals. We're going to ask you a whole bunch of questions. to see what point prescription, what combination of different points would be appropriate for you. Now, it's safe to anticipate that some of those points are going to be on your tummy, they're going to be on your abdomen. Some of those points might be on the hands, some of those points might be on the feet. We may even opt to have you flip over and do a double-sided treatment and target some points on the back. Now, you got to understand that usually with these types of ailments, they're typically not very easy to treat. We really got to target it from multiple different angles. So there is going to be a dietary aspect to it. There is going to be a meditation and relaxation aspect to it to make sure your stress levels are low. There is going to be a nutritional aspect to it to make sure you're eating the right things at the right times in order to create that balance inside of you. I hope this information has helped. If you have any questions, any concerns, please feel free to reach out to us. You can book a consultation at the link below. And I look forward to hearing from you, and hopefully we can help. Thank you, and have a great day.